You didn't start your practice just to pay the bills. You wanted time, freedom, you want real money. But if money's not flowing, then there's a reason. And it's probably not what you think. Today, I'm going to break down the 5 reasons why practice owners are not making the money that they deserve and how to turn that around. Stick till the end because the last one is a wake-up call. First is you're still thinking like an employee, not like an owner. You're still trading your time for money. If you're treating the patients, that's what you're doing. Owners focus on creating systems that can create the result for the patients without them being there. You have to create a system where your team can help your patients get the results that they want. You have to find a way to be able to duplicate or multiply yourself. Number 2, you don't know your numbers. If you don't know your break-even point or your profit margin or your acquisition cost, then you're flying blind. You have to know your break-even point so that you know how many patients do you have to see so that you'll be able to pay all your bills, pay all your staff, including yourself. If you don't know your break-even point, then you're just hoping that you're seeing enough patients that your practice can be profitable. I also see a lot of clinics that are not tracking their expenses. They're overspending and they don't even know. You have to know your revenue and you have to know your expenses, and you have to make sure that the revenue is more than the expenses. This is how you can be profitable, and you're not just hoping that it balances out. Number 3, if you're relying on walk-ins, then that's a problem. If you don't have a referral system, then your patient volume and your income can be fluctuating. You need a marketing strategy so that you can have consistent leads. You need predictable systems that can generate consistent referrals. That can help you avoid the highs and lows in your income. Subscribe if you learned something new. Number 4 is you're undervaluing the transformation that you provide. If you don't believe that your service is worth a premium price, neither will your patients. Charge based on the transformation that you provide, based on that value, not your time. And if you can create the transformation in a shorter period of time, then you should charge more. It's contrary to when you charge patients for your time, then you have to see patients longer. People nowadays want faster results, and they will gladly pay to get that in less time. Number 5, you haven't fired yourself from the $20 an hour task. You might still be doing everything in your clinic, like scheduling, admin tasks, payroll, bookkeeping. Heck, you might still be cleaning your clinic. You're still doing those lower value tasks instead of focusing on the $1,000 an hour CEO tasks, such as growth strategies and leadership. You're not going to be able to make real money if you're stuck making cheap money. Your practice should be a vehicle to your wealth, not your prison. But you have to start thinking like a business owner, like an investor, and not just a clinician in charge. They have managers and clinic directors for that. Watch the next video to learn more in growing your practice.